Good afternoon, everybody. My name's Scott. I'll be the presenter today. We're going to give everybody a minute or two as they filter into the lobby here, or out of the lobby or waiting room, I guess. And then we'll go ahead and start the presentation. So hang tight. For those who are waiting, a couple of house cleaning items. If you do have any questions during the presentation, feel free to, you can put them in the chat. We'll be monitoring the chat for questions, and we can address those either during the presentation or at the end. And then at the end, also feel free, I'll have enough time to take yourself off mute. If you'd like to ask a question directly, we can do that. We can do that as well. All right. Well, it's a couple of minutes after our start time. So I'll go ahead and get started. So those of you that have other things to move on to today, you can get to those. So this is the second in a series of webinars we're doing throughout the year. If you didn't attend the one in January, we did it on neck pain, prevention and self-care of neck pain. So this is a continuation down the same pathway, but I thought I'd just start by introducing myself and IMC as well. So IMC, for those of you who are not aware, stands for Integrated Musculoskeletal Care. And we're a musculoskeletal healthcare company that provides services either direct to patients or to employers to provide care for musculoskeletal problems, which those can be anything from neck pain to back pain, other joint pain, muscle injuries or ailments, nerve issues. The list is rather robust. And so we do this by we use physical therapists and chiropractors in order to assess and care for people who are struggling with these conditions. So I myself, if you see on the screen there, my name's Scott Eiselt. I'm a physical therapist, been a PT for 19 years, and then I hold postgraduate training in an assessment process called mechanical diagnosis and therapy. And so all the clinicians that work for our company have that same level of training so that we can provide reliable assessment and the same outcomes from clinician to clinician across, regardless of who you see. So today we're going to touch on, so that's enough about myself and IMC, but we're going to touch on shoulder pain. And we'll talk briefly about some facts about the shoulder, some things you might know, some things you might have misconceptions about. We'll dive into some contributing factors of shoulder pain, things you can do to potentially lower the risk of having a shoulder issue, and then some action items that you can try to do if you do have a shoulder issue that pops up. And then lastly, brief introduction around how you would access care through our organization if you did have a need to do so. All right. So first off, shoulder pain, as far as, I would say last time we looked at as far as prevalence, it's the joint in the body across our book of business, if you will. I believe it falls around the third or fourth most common reason why we see somebody in the clinic. Some interesting facts about shoulder. First one that I wanted to touch on, it's really important, is that multiple studies have now been published over the last few years looking at the relationship between the shoulder and the spine, and in this case being the neck and upper back. And depending on the study and how it was designed, somewhere between 29 and 48% of shoulder pain has been found to be of spinal source. And so this means somebody's condition, when evaluated and cared for, they cared for the condition at the level of the neck or upper back, and their shoulder condition then resolved as a result of that care. So we'll dive into that a little bit more in a moment, but it's just something to consider as if you're currently struggling with shoulder pain or have in the past, is that there's a common relationship between the spine and the shoulder in and of itself. All right. One of the most common, I would say, telltale signs that your issue may be actually of neck or upper back origin would be if you have pain in your shoulder blade or shoulder blade area, often confused with then a shoulder problem, but in reality that area is often fed by the spine, the upper back and the neck itself. So that can be one of the first things you might start considering is, where is my pain located? Another thing that I think is there's been a number of studies done around we'll say, how common are rotator cuff tears or labral tears or other types of what we'd call like structural lesions in the shoulder in people who do not have impairment or pain or any limitations. And around 44% of people over the age of 45 actually have an asymptomatic rotator cuff tear. So this means these people are walking around without any impairments. They don't have any weakness, no pain. But yet, if you did an MRI of their shoulder, 44% of them are likely to then show some level of a tear in their shoulder. So one I didn't put on this, another one worth noting, is that there was a study done of overhead athletes years ago, and they took Major League Baseball players that did not have any previous history of shoulder injury, impairment, weren't on the injured list, and did MRIs of their throwing shoulders. And over 71% of them had what they would define as an operable lesion. This means there was a problem on the MRI that said that they would justify surgery, yet these individuals their shoulders were performing at a level that is well above the average American, given they can throw a baseball as fast as they can. And interestingly, they did a 5-year follow-up of those same participants in that study, and none of them had been on the disabled list or had injured their shoulder on follow-up, even though they had these findings on the image. So what kind of conclusions can we draw from that? It's not that imaging it doesn't have a place. It's just important that we have a assessment process to determine when is the finding relevant, and is an image the only thing we should use to make our treatment decisions. All right. And so it's important that we have an assessment process that can guide us to the right treatment pathway. And if indeed the assessment process points towards a problem that is structural in nature, then the MRI is there to help validate that or kind of demonstrate that as well. All right. The next point I wanted to look at is that 2/3 of mechanical shoulder pain is actually rapidly changeable. All right. And what this would mean is that if your shoulder problem is coming from your shoulder, through the right assessment and movement plan, 2 out of 3 people can rapidly resolve their condition. Now, what's rapid? Rapid is that in the moment, we can create cause and effect of your problem. And then typically in a matter of 2 weeks, you're nearly 80+% improved overall. So this condition can rapidly correct itself through movement-based care, we would call it. So, and so versus what is not rapid, I would say rapid is days to weeks, and then weeks to months is something that's going to be slower. It's not that it can't change, but it's going to take more time or other interventions. Okay. And then the last one I wanted to touch on, I touched on this in January with the neck as well, and we see this across all joints in the body, but inflammation gets a bad rap, and it is a necessary response that the body uses to heal injuries, heal itself, repair itself. Without it, we wouldn't be able to repair and heal. However, it's not meant to be present all the time. It's only meant to be present for a short period of time after an injury or as a response to something in the body that the body needs to address. If you watch any amount of television, you think that everybody has inflammation, the amount of, go get this injection or take that medicine or what have you. And those things help pain, but they don't often get to the root cause of the problem. And the reason for that is because less than 5% of shoulder pain is actually inflammatory in its root. All right. So if you have a problem that is mechanical, which means it means movement and exercise or some other intervention, and you had an injection in your shoulder problem might feel better for a short period of time. That could be days or weeks, but it's likely not going to remain better once that medicine is no longer in there, or in some cases, it won't have an impact at all because the problem wasn't inflammatory. And so therefore, the treatment using an anti-inflammatory doesn't work. In some cases, when the problem is an inflammatory problem at its root, let's say you had a tendon that was inflamed and it couldn't get stronger and wasn't repairing itself, and then you got an injection or took a medication, then the problem would be addressed and it wouldn't come back. That's where then the treatment matched the root cause of the problem. So just a couple of things to think about there. All right. Diving into that first one I touched on, this is a really important one that we see in the clinic, and that the study that I wanted to touch on here is that this particular study, they did it throughout the body, but I want to zone in on shoulder. They used the same assessment process that all of our clinicians at IMC utilize, and they did it in 6 different countries around the world. So this wasn't done in one clinic, and so therefore it was much more generalizable across different cultures as well as then different patient types. And it took people who had standalone shoulder pain. So you couldn't have neck pain or shoulder blade pain or anything like that. The pain had to be in the shoulder itself. And then upon examination, they were able to resolve 48% of those shoulder problems with moving the neck and upper back. And the remaining 52% of those were shoulder problems and did not resolve at that level of care. And so when considering seeking care for your shoulder, I think remember this study, remember this fact, so that whether you're seeing a physical therapist or a chiropractor or one of our clinicians, that you're aware of the possible link between the spine and the shoulder itself. All right. So jumping into some shoulder health concepts, some things that I think we can all wrap our mind around and just touch on how we can remain healthy. What should we do to keep our shoulders functioning healthy as we move into life or different activities? Number one is trying to live an active lifestyle. Living an active lifestyle, that can be different for different people, but it keeps your tissues, by tissues I mean whether it be muscles and tendons or ligaments or bony structures, with a certain degree of vitality. So they're used to stress and strain because you're constantly utilizing them, which means they're going to be more robust and be able to tolerate the different demands that you throw at them, and therefore they're going to be more resistant to injury. All right, so just some level of an active lifestyle. Now, with that in mind, you want to try not to go from 0 to 60 too rapidly, because when we surprise our structures with, let's say, something that's out of the ordinary or too strenuous, that's when we can encounter potentially an injury, or we can reveal a problem that we've had that we didn't know was there. Right. The next thing to think about would be maintaining range of motion and flexibility. And I'll show you a movement before this is all said and done, probably the most powerful movement in order to help us do so. But moving your shoulder, it's one of our most mobile joints. It has the most freedom of movement compared to all joints in our body, but we need that movement. And so making sure that you are capable of moving your shoulder to its very limits can help then again keep it robust, keep it tolerant of stress and strain. And specifically their end range joint movement. So what this means is moving that joint to its very furthest range that's possible. And certain movements, or certain directions of movements, I should say, are going to be more preventative, and we'll jump into that in a minute, if you move them to end range. All right. And what that does is it helps you identify if your joint is getting stiff. It can help maybe reveal impairments, if you will, that are in the joint. But if we don't know what to look for, or quite frankly, where to look, we'll often not move our joints to end range. Because in our everyday life, we actually live in what's called mid-range. We don't move our joints to their limit very often. Instead, we move them within a certain kind of boundary, if you will. So if we never take them in end range, we don't know what our limits are. I touched on living an active lifestyle, strengthening surrounding muscles. So some amount of resistance training can help keep your muscles and tendons tolerant. So if you lift something or unexpectedly you had to lift something heavy or something dropped and you went to catch it, your tendons are used to taking on stress. All right. So the most commonly injured tendon in the shoulder would be there's four tendons that make up the rotator cuff. All right. And commonly those are a source of tendinous injury or pain. And so some level of strength training can keep those tendons tolerant of stress and strain. All right. Repetition and prolonged positions. I kind of linked this back to what I said earlier as far as we live in mid-range. So we commonly move our shoulders in the same directions. We're habitual people, most of us. Whether you work at a desk, you work on an assembly line, you deliver paper or mail, whatever it is, your shoulder's probably doing much of the same things day in and day out. And so interrupting those positions with movements that are opposing those commonly used positions or movements can help keep a balance, if you will, within the joint and prevent issues from arising. And last but not least, it can't be stressed enough to address painful impairments when you notice them. All right. So commonly patients will ask, or they'll ask about a family member, hey, so-and-so has this problem, should they get it looked at? And and this is anecdotal, but I'll often give people the 2-week rule and say, look, if you develop a new pain, you wake up and something doesn't feel quite right, well, give it a little time. Our body is really good at correcting itself. All right. If it wasn't, we wouldn't have been on the planet as long as we have. But in a matter of 2 weeks, you should notice significant improvement in whatever that issue was. And if you do, you give yourself another 2 weeks. But if at any point in that time the process plateaus, you need to get that looked at, because then your body is not going through its natural recovery process. All right. And the exceptions to that would be if you, quite frankly, you're debilitated or the pain intensities are so high that it's concerning. Well, then don't wait 2 weeks. Go ahead and get it addressed, because the sooner you address the issue, the less impairments that are going to stem from it. All right. If you wait and wait and wait, well, now the problem might exacerbate itself, it might get worse, or you start to limit the abilities that you have by not using a joint or a body part. So then you get secondary and tertiary limitations that need to be then unwound once you do finally get care for it. So 2 weeks on the long end. On the short end, it never hurts to get a qualified opinion about what's going on. But I will say I would be careful with like Dr. Google or some of those things for obvious reasons. All right. I touched on this. I won't belabor it anymore, but prevention, if you look at these 3 things people are doing, kind of bending down and reaching, looking down at a cell phone or a book or a computer screen or driving, or positions we put our neck in, and then reaching either up or in front of us. We live kind of in front, below, and above, but we rarely go behind us. And we look down a lot. So I want you to think about prevention as like, if this is what I'm doing all the time, I need to start to then oppose that and interrupt those positions, because my structures are going to then start to adapt and get used to only doing that. So this comes in, if you were on the webinar in January, we talked about neck pain. This is the same movement you would have learned then. But if I go back one screen, if we look down all the time, all right, our neck starts to then develop too much movement in that one direction. We need to create a balance. Okay. So see if I can get the video to go here. So this particular movement is going to be pulling your head in and then looking up and backward as far as possible. Okay. So this is the movement I want you guys to consider doing. If your shoulder hurts, taking yourself through that movement in repetition 8 to 10 times, and then try whatever your shoulder was hurting as you did it and see if it's different in any way. If so, you might be in that 29 to 48% of people that we talked about earlier. Okay. So keeping this movement from becoming stiff can reduce a high percentage, obviously near anywhere from 1/3 to a half of shoulder impairments from occurring. All right, so that in and of itself can be a very powerful tool. The second one, we touched on end range movement in directions we rarely go. Okay, so we live with our shoulders in front of us. Okay, in mid range. So the most preventative movement for us in that regard is going to be pulling our shoulder behind us. So you pull your wrist to your spine or to your tailbone, and then you pull it up your back. All right. And maintaining flexibility in that direction can help keep the shoulder joint free of impairment. All right. Now that seems pretty simple. But the other thing it does, it can identify if something is starting to occur. So if you do that, let's say that neck movement and the shoulder movement daily, you'll know what your normal is. And if one day you go to do that and you can't move your arm up your back like you could, you need to start doing that movement instead of just daily, but more like 4 or 5 times. And you should expect it to readily get better. And if it doesn't, you need to seek care. Okay. So I'll play that one more time so that everyone can see kind of how that's done. And you want to make sure you're going to your end range. So you got to take it to its very limit. Okay, which in some cases is uncomfortable. Okay, so diving into the prevention self-care piece a little bit more thoroughly. So I just touched on daily doing that, so you're aware of what your quote unquote normal is. Okay, and then if you start to notice that you can't move as far, or you have some stiffness or pain with that, then you're going to increase, if you go down to the third bullet there, the repetitions to 4 to 5 times in a day, and expect that problem should resolve in a matter of days, maybe even that day itself. If it worsens or doesn't resolve, that's when it would trigger you to then seek an appropriate amount of care. Okay, so those 2 movements that I showed you for the neck and the shoulder, they're not meant to correct all problems. They're meant to prevent problems from starting. And then if they do start, they're meant to help identify. Those are the 2 most powerful things they can do. They just happen to also correct a certain amount of them. All right. So if it's not corrective, then you got to take it to the next step. All right.
Hey, Scott.
So next, yeah.
Hey, quick question from the chat. Just since it was about the video, I thought I would ask now. So Lisa asked if this action hurts on one side, could scar tissue be causing this pain?
Yeah, great question. So if there is stiffness within the joint, scar tissue is one possible source. Yes. So scar usually arises if there's been a previous trauma or an injury, and then the body healed itself, and then that scar was not adequately stretched out or changed back to normal. Our body can also adapt into what's similar to a scar, where our tissues are shorter through lack of movement. So if you just never take the shoulder in that position, for instance, your body can adapt, and then your tissues shorten, and it's kind of like a scar, but no trauma was there. So that's possible. But then there are also where our body can have things that get kind of caught up in the joint that are naturally in all of our joints. They get kind of stuck in the way. I think of it like a rug in your home getting kicked up and stuck in the doorway, and the door won't swing freely. In those circumstances, the problem can be more rapidly correctable, like I touched on at the beginning of the presentation. So, and that would be identified by seeing that problem change rapidly versus the scar will change slowly. It will be the same thing over and over again, and it'll take about 2 weeks to change. Or to notice change, I should say, but it could take up to 2 months or more to fully correct a scar problem. Hopefully that answers that. A good time to kind of dive into this, though, is that if you do have a problem that didn't seem to get better with attempts at self-care, the first level we would recommend is, and I'll give you the web address of this, is we have a kind of, we'll call it a self-help app, where you can go in there and basically tell the web app what level of problem you're having. Like, oh, I have a shoulder problem. And then it'll take you through a certain level of testing. And if your problem responds appropriately, it will again give you a self-care treatment opportunity. So you can then go ahead and self-care, and it'll have you touch back and give it feedback over the course of time and make sure things are progressing properly. And if so, that it'll take you then towards resolution. If your problem doesn't respond to the self-care appropriately, it would then recommend you receive some level of kind of escalated care, whether that be in-person care with one of our at one of our sites or virtual care. Right? And so that would be dependent upon if you found your way into this webinar because your employer utilizes IMC as a musculoskeletal care partner, then you would have virtual care as an option, or in-person, depending on your location. So for virtual care, that's something we do through like a virtual meeting, like a FaceTime, if you've ever done that, something similar to that. And this is a very highly effective tool to where we do the same testing on somebody as we would in the clinic. We can't put our hands on them, but we're able to then get the same outcomes as we do with someone in the clinic, and that we rarely need to escalate beyond that. So that's an option, really great option. So if you've heard that you have that within your group and haven't utilized it, I can't promote it strongly enough that it's a great tool to make sure you're getting the care you need. All right. And then depending on location, we do have some sites have IMC clinicians on site, and you could then pick from virtual care or in person in those circumstances. So here is that. If you can either scan that code on your screen while it's up, or you can save that URL and then utilize that for self-care. There's also a preventative portal within the web app that can give you information around keeping various joints healthy. And then Nick is going to post this, or we'll post the deck in the chat so that you guys can come back to this at a later time if you'd like. So, but at that, I'll pause and see if there's anything more on the chat room, Nick, or if anybody has a question they'd like to then come off mute and state.
Yeah, Scott, it does look like there was one additional question already in the chat, which was for the preventative movement that you were talking about earlier. If someone is unable to do that movement, does that mean that they have an injury?
If you're unable to do it on both sides, it doesn't necessarily mean you're injured. We also have, I'll say, just everyone's anatomy is different, and so your shoulder might not move as freely as that. So there are alternatives to that movement that you could be shown. One option would be to like hold on to a broom, for instance, with the stick across your back, and you can kind of slide the broom up your back. It then takes the arm behind you if you're having trouble reaching across. But there are some variations. Now, if you can't do it because it's painful and limited on one side and not on the other, then that is suggested that there's a problem there that would be of value to get looked at.
Great. And looking through the chat, I think that was the only other question. We have had, just from a technical perspective, we have had some questions about the neck pain webinar that occurred in January. So I will also post a link to that in the chat as well, so that anyone that attended this meeting can also go back and view that one. It looks like there were a few people interested that didn't have a chance to attend the January one, but would be interested in listening to the recording. So I'll go ahead and post both of those in the meeting chat for you to access after the fact. And then the copy of this webinar will also be emailed to you as a link afterwards as well. So if you want to watch it again, or if you want to forward it to anyone, you'll have access to it in both ways.
Great. Well, thank you all for attending. If you, like Nick said, this will be posted on the chat, and then, like I said, we'll be doing these every other month through the rest of the year. So, kind of watch your wherever you receive your announcements, and that then come May, we'll pick another joint system and go through it similarly as far as like how it works and what are the best things you can do to look out for to prevent problems or address them. So be on the lookout for more joints to come if you're having if you're curious about that. But don't hesitate to reach out in advance of that if you have a different joint that you wanted to be cared for. Don't wait until the webinar necessarily if you need care now. So, but with that, I'll say thank you for attending. Hope you got out of it what you wanted to, and have a good rest of the week.